afternoon, everyone. My name is Brittany Sandage, and I am the Director of Coalition Programs here at Drug Free Action Alliance, located in Columbus, Ohio. I'm very pleased to welcome into our offices today some wonderful guests who are going to share more of their resources with us, talk to us about some prevention programming they have available, and entertain a conversation. Before we get started and I let Dr. Hale take it on, let me just share with you, if you check out your dashboard, you will notice there is a question box as well as a chat box. We will do our best to monitor it throughout the presentation today. Please be advised we will do our best to take the questions and address them at the end of the presentation. All right, and without further ado, I'd like to kick it over to Dr. Hale.
Well, good afternoon, everyone. My name is Ken Hale. I am delighted to be with you, and we have 3 members of our Generation RX team that will be talking to you in the next hour. And we'll be talking about our Generation RX resources for prescription drug misuse prevention. I am a clinical professor at the College of Pharmacy at Ohio State University. I am also co-director of the Generation RX work in our college, and I am associate director of a new center at Ohio State called the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery. I'm joined by Betsy Walker, who is the Director of Community Relations at Cardinal Health, and also Dr. Molly Downing, who is a clinical instructor in our College of Pharmacy as well. Molly has been intimately involved in developing some of the resources we will talk about today. So we're going to be talking about Generation RX. This is an effort to promote safe medication practices for life. Betsy's going to tell you a whole lot more about what that means here in just a few minutes, but first let's do a few little business items. In terms of disclosure, let me note that the primary support for Generation RX does come from the Cardinal Health Foundation, where Betsy works, Cardinal Health. Let me say also, and kind of characterize that support, this has been a very robust partnership, truly a partnership, not just a granting operation from Cardinal Health side. So, we have regular meetings. They've been involved in the development of resources. We work together. They've helped spread them. They've helped market them. And really, due to their influence, this has become a very robust national piece of work. And actually, literally, the resources we're going to talk about in the next few minutes have been used in every state in the country, and they've touched millions of people across the United States. So we're very honored to be having Cardinal Health as our support, but it's more than just funding. It's truly a partnership. Let me just go through 3 fairly simple learning objectives that we have for our webinar, and they are fairly simple. First of all, I'm going to spend a few minutes with you at the beginning talking about some compelling information relating to the scope, causes, and consequences of what the Centers for Disease Control and Prevention have called America's prescription drug misuse epidemic. I think that all of you on the line have some feeling about this epidemic and understand certain aspects about it. I'm going to have just a few touch points with you in terms of more of what that means. Betsy's going to join us then and think about what are our Generation RX resources. These are free resources ready for you to use, and she'll describe them in much more detail. In your community-based educational prevention efforts, how can you use them towards making our patients and our community members move towards safe medication practices for life? And then finally, we hope to differentiate effective methods for educating youth, teens, and adults around this issue in trying to impact this serious public health problem. Dr. Downing is going to join us at the end of the presentation and talk about some of our materials designed for teens, and in that discussion will kind of give us some guidance in terms of how we might think about working with teens differently perhaps than we would with working adults in our community. So let me take a few minutes with you here and talk about this problem. I think I'm talking to a pretty savvy audience, and by the way, we're very pleased that you have joined us. The number on the line is very impressive to us. We're happy to spend the time with you, and we will give you some information now. We're happy to follow up with you later as well. But let's think about this drug misuse epidemic and what it means in the United States, and then what it is that we need to do in our communities to try to fight this epidemic. I'll bet you that most people that are listening to this webinar are aware of the National Survey on Drug Use and Health. It's a big national survey done by the Substance Abuse and Mental Health Services Administration, SAMHSA. They do live interviews with about 86,000 people aged 12 and older across the country every year, provide just a wealth of information about mental health issues as well as drug use and misuse in the United States. Well, we know that in an average year, 6 to 7 million Americans have misused a prescription drug in the past month. If we look at 2014 in particular, it was 6.5 million. So that means in the last month that many people have misused one of these substances we're going to be talking about. By the way, the National Survey on Drug Use and Health characterizes these as psychotherapeutics, and that means prescription opioid pain medications, tranquilizers, sedatives, and stimulants. So those are the classes of drugs that we're typically talking about in the controlled substances category. So we know that in 2014, the latest year we had these data, that there were 6.5 million current misusers of these agents. We also know, interestingly, and I think importantly for you to think about, that 5,500 Americans misuse one of these substances for the first time every day. I think that's why we're having this webinar. How can we cut that number down and get in front of some of those 5,500 who will do it today? The second point on this slide tells us that prescription pain medications, sedatives, and stimulants account for the most common substances of first misuse. Let me kind of characterize that for you. We know that marijuana as a single agent is the highest culprit in terms of first misusers of substances. And in 2013, 2.5 million Americans aged 12 and older used marijuana for the first time that year. But if we take the psychotherapeutic compounds that we've described to you already and add them together, all those different categories of drugs add up to about 3.5 million first misusers in 2013. So if we take those substances added together, we know that they are far and away the most common drugs of initiation for misuse. And then finally, we know that there's reason for us to think about how we educate folks in terms of how they store and use and dispose of medications, because about 2/3 of those who misuse prescription drugs get them from family members or friends, most often for free, again from the National Survey on Drug Use and Health data. If we look at 2013, 53% of Americans who misused got the medications from relatives or friends for free. Another 14.6 bought or took them from relatives or friends, so that totaled over 67%. We know that the vast majority of those who misuse get them from family or friends. It provides us talking points in terms of how we educate our communities around this issue. I want to think about some selected consequences with you in the next minute or so here. I'm going to talk to you about some health consequences, but we obviously know that there are also other kinds of consequences like social consequences, legal consequences. There are myriad kinds of things that happen to us when we misuse these substances. But let's talk about just a few talking points around what are health consequences. First of all, we know that since 2007, there have been more emergency department visits in the United States relating to medication misuse than those relating to illegal drugs. We also know that drug overdose is the leading cause of accidental death in the United States, and this has been the case since around 2010, 2011. And let me characterize this overdose death statistic, because there's some interesting kind of caveats to it. Number one, if we look at drug overdose, the number of people who die per year from drug overdose is about 1.5 times the number who die from motor vehicle crashes. So not only are they higher, they are significantly higher. It's far and away the leading cause of accidental death. We know that in 2014, over 47,000 drug overdose deaths in the United States. That equates to about 129 deaths per day on average, 129 deaths per day. And if we look at the 15-year history in this realm, we know that we've had increases on prescription drug and opioid-related deaths in particular have climbed every year for the past 15 years. Since 2000, nearly 500,000 deaths from drug overdoses. It's quadrupled during that period of time. And then, we all are acutely aware of, the heroin issues in our communities and the devastation that's causing in terms of, death and all the economic burden and social issues that come part and parcel with that. We also know clearly from data that was published in the Journal of the American Medical Association 2 years ago now that 3 out of 4 heroin users first report misusing a prescription opioid. So we know that these kinds of drugs are kind of the gateway into substance misuse. We also know that those who misuse prescription opioids sometimes will transition into heroin use. This slide that I have in front of you from NIDA tells us that 1 in 15 of those who misuse opioid pain medications will try heroin within the subsequent 10 years. So certainly not everyone who misuses these prescription drugs are going to make that transition, but some do. And for those who do use heroin, we know that about 2/3 of them, or 3/4 rather, started off misusing prescription opioids. So the connection between these things are kind of chilling. We know also that if you look at the kind of the logistics of these phenomena, that if we looked in the past decade, it took about a decade for deaths due to opioid pain medications to double. It took 2 years for deaths due to heroin to double. And in fact, in the last 4 years, heroin overdose deaths have tripled. So this, this is maybe the big gorilla around this topic that we're addressing today. But some of the fundamental things that we'll talk about in terms of prescription drug misuse are kind of feeding into this phenomenon as well. I'll bet you also that many of you have seen this book that's on the slide in front of you. It's called Dreamland, The True Tale of America's Opiate Epidemic by an author by the name of Sam Quinones. Sam is a journalist, worked for the LA Times and in a previous role, but he's written a very well-researched look at what has happened in terms of how we emphasized the treatment of pain in the United States at the end of the 20th century, how kind of unscrupulous perhaps some pharmaceutical marketing techniques got involved in this and using some kind of sketchy research, if you will, and how they would describe it in terms of trying to push that use of narcotics and opioid pain medications more aggressively, and then how the black tar heroin market out of Mexico followed that practice. So Sam I really urge you to read this book. If you haven't picked it up, I really urge you to do so. If you're listening to this webinar in Ohio, much of what you'll read in Dreamland is based in Ohio, and much of it's starting off in Portsmouth, Ohio, which is where the title came from, Dreamland. It was the name of a pool in Portsmouth. And it's how our communities changed, how the substance use issues changed, and how this kind of has become the epidemic that it has. By the way, if I could make a shameless kind of offer for you to join us in August, the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery's national meeting is August 2nd through 4th. Sam Quinones will be a keynote speaker on August 3rd. This will be at the Blackwell Inn at Ohio State University. I think you've been getting things from Drug Free Action Alliance in terms of registering for this meeting. You can also go to hechod.osu.edu if you wish to register. We'd love to have you join us. So, we've got this problem. We know that there's some very significant health, social, and legal consequences that follow it. I like to characterize this as really a perfect storm in terms of what has caused these things that we're talking about. I think that there are really 3 critical issues that kind of come to bear in this perfect storm that created the mess that we may be in now. First is the U.S. drug-taking culture that we live in. We fill close to 5 billion prescriptions per year in the United States. I think we use something like 90 or 95% of the world's hydrocodone supply. We have a quick fix mentality. We see drug ads on television, which is very unusual for developed countries. It becomes normalized in our culture. The author of Generation RX, the book Generation RX, authored by Kritzer, called this pharmaceutical populism, a culture in our country of self-diagnosis and self-prescribing. We are a drug-taking culture. Secondly, we have easy access to these medications. Again, we have about close to 5 billion prescriptions filled per year. In Ohio alone, in 2015, there were 701 million doses of opioid pain medications prescribed. And we know that most people who misuse these substances get them from family member or friends. So ease of access is part of that perfect storm. And finally, there are misperceptions around, are these drugs addictive, or can they be? Is it legal to misuse them? Is it safe to do so? So there are lots of misperceptions around safety, legality, and addictive potential. These things on this slide really are the foundation for what we'll learn more about here in the next few minutes around Generation RX. How can we correct the feelings, the understanding, the awareness around these 3 points? And then, what do we do? So I'm going to just highlight a few touch points with you here. I've got something in front of you, which is the Office of National Drug Control Prevention. The office of the White House's kind of drug control area, and the drug czar. This is their prescription drug prevention, misuse prevention plan. It was actually issued in 2011, still current. They have 4 key components. The first is education, second, prescription drug monitoring programs, third, prescription medication disposal, and finally, enforcement. Let me just highlight a few things about each one of these in terms of what we do. I want to think about education with you, and some of these things are in the plan that you can read. If you just Google this, you'll see it. And we will see that, they'll talk about educating the public. So what do we do vis-a-vis what we're talking about today in terms of our communities, our schools, and our families and our friends? So how do we educate the public? We're going to present some very interesting tools to you here in the next few minutes that may be helpful in that regard. We want to be educating prescribers in terms of how they are prescribing these substances because of the access issue. Sam Cañones said that this issue that we're talking about started as a supply problem, not a demand problem. So the ease of access was an issue that really kind of got us started down this pathway. Also thinking about how we educate people in terms of things like harm reduction around naloxone use, in terms of preventing drug overdose deaths. If we think about prescription drug monitoring programs, I'm going to talk just for a second here about what's happening in Ohio. I think there might be some of you on this webinar outside the state. But if I look at our prescription drug monitoring program in Ohio called ORS, we have some recent changes that are really trying to drive how effective that can be in terms of preventing this issue. Pharmacists are required now to look at anybody that's getting a new or different controlled substance prescription to do a report. If we haven't had a report done in the last 12 months, they must do one. If the prescriber or the patient is from a different geographic region, we must do a report. If the pharmacist has reason to believe the patient's getting medications from multiple prescribers or sees signs of misuse or diversion, we are obliged to use these drug monitoring programs. They are now fully operational in 49 states, and I think the final state being Missouri is in the process of building their monitoring program as well. In terms of medication disposal, one of the things we can think about in our community coalitions is the availability of drug drop boxes, the availability of drug take-back events. We know that our Drug Enforcement Administration has kind of loosened the rules on this a little bit in terms of what pharmacies can do, what our communities can do. So think about drug disposal in your plan, and then of course law enforcement in terms of how we crack down on things like pill mills, and that's come fairly far away in the last several years. My last slide here is a call to action for you. The materials you're going to hear about are from generationrx.org. They are free. You can check them out while we're talking here, even if you want to. Think about what we can do to help our families, help our friends, help our schools, help our patients understand the kind of the parameters around this issue in terms of prevention. This is kind of corny, but I like to use a metaphor around Shrek when I talk about this problem. Shrek said that ogres are like onions, right? And Donkey said, why? Because onions, they stink and they make you want to cry? And Shrek said, no. Onions have layers, ogres have layers. We know there are many layers to this problem. We are not suggesting that these little tools that we're going to show you in the next few minutes are the end-all and be-all for solving this problem, but they are part of it. I believe the educational piece is at the core of this onion. We've got to think about disposal and treatment and recovery programs and access and all the other things as well. So it's been a pleasure talking with you for these few minutes. I'll come back to you at the end. I'm going to actually pass my headset to Betsy Walker now, so if you'll bear with us just for a few seconds, we'll switch gears. She's going to talk to us about Generation RX resources and community coalition involvement.
Hi, good afternoon, everyone. This is Betsy Walker. Thank you for the introduction, Ken. I work for Cardinal Health, which is based here in the Columbus area in Dublin, and I'm the Director of Community Relations. And so the work that we do together with Ohio State College of Pharmacy on Generation RX, as Ken had kind of teed it up earlier, is really work in partnership together on creating the education for all of the resources, as well as identifying what is the best way to engage with the community as a whole nationally. And so the prevention community, and particularly community coalitions and those that are involved in community prevention at whatever level you are in your community, is a critically important audience. And so I'm going to touch on that today around the value and the importance of community coalitions involvement. And so before we do that, I'm going to jump into giving you more detail around the Generation RX program. I understand that some folks on the phone may be familiar with it already, while others are new to the program, and an overview might be helpful. So I hope what I share today will be able to hit on both of those groups. So let's talk first about what Generation RX is. It's a national partnership between the Ohio State University College of Pharmacy and Cardinal Health Foundation to increase awareness about prescription drug misuse prevention with the public, and we do that in order to encourage action in the communities across the country. We've been working on Generation RX since 2007, where it started on Ohio State's campus. Cardinal Health became a partner in 2009, and since then we have developed a whole suite of education for all audiences, from the very young to the very old, for elementary school students all the way to senior citizens and everyone in between. And a core part of the program, a key goal of Generation RX, has been and will always be to provide resources to communities that are ready to use, will always be free, will be accessible and open source for you to use, that are on our public website, generationrx.org, and really focus on medication safety education. And so we'll talk a little bit about what that means, and I'll give you some examples, specific examples for the adult education, and then Dr. Molly Downing, who's also on the call, will also share the resources for youth. So I wanted to highlight just a few of the outcomes that we've been able to accomplish here with Generation RX over the years. As Ken had mentioned, we now have these resources in every state. That is a pretty significant success, we will call, and that's in part due to community support, community coalitions, and community members like yourselves who are just passionate about bringing this education. When we talk to those that have participated in a Generation RX presentation or used the resources, been a part of the education, 85 to 95% of those participants report that they won't share medications or take medications not prescribed for them. So we're looking at not only tracking the use of these resources, but also what are folks' intent to change after they've been educated on medication safety. The next layer of that in the future would be working on actual opportunities to track behavior change associated to it. So we're excited about some opportunities there. I mentioned before that we have education for all audiences, and those include elementary school students, teenagers, middle school and high school, college, university resources, general adult community resources, senior citizens, patient and workplace audiences. So those are a bit unique, specific to those adult audiences that are patients, as many of us are, as well as workplace, which is both the employer and the employee side. One way that we have been able to spread Generation RX across the country is through a wonderful partnership that we have with the American Pharmacists Association, as well as the state pharmacy associations. So while I know most of you are not in the pharmacy industry, I did just want to call out that there are 134 colleges of pharmacy across the country. There are 7 in Ohio. And we have 91 colleges across the country that are already actively involved in Generation RX. Together in the year of 2015 alone, they educated 165,000 people at those colleges of pharmacy. So if you have a college near you in Ohio, and I can list off where those are, I would strongly recommend contacting the College of Pharmacy there and seeing if there might be an opportunity for you to work with a student pharmacist there who are already engaged in Generation RX. They have great ideas, they're passionate, they're innovative, There are oftentimes a large number of them involved at the college, and I think that it would be a great partnership for you to work with them. So the 7 colleges in Ohio that have colleges of pharmacy are Ohio State University, Ohio Northern University, Neo-UCOM up in Rootstown, University of Findlay, University of Toledo, Cedarville University, and University of Cincinnati. So they're pretty spread out across the state, with the exception of maybe Southeast Ohio, although Ohio University's College of Medicine here in Columbus at least has been involved in Generation RX. So let us know if we can help with that. We have great relationships with colleges and would be happy to introduce some relationships there if you're interested. And then I finally want to mention 2 really valuable resources we have. While they're based here in the Columbus area, I think they're statewide resources and national resources, really. One of which is the Generation RX Lab, which is based here at the Center of Science and Industry, the Children's Science Museum here in Columbus, as well as the national meeting that Ken had prior mentioned of the Higher Education Center for Alcohol and Drug Misuse Prevention. That meeting again is August 2nd, 3rd, and 4th here in Columbus, and we do have a Generation RX track specifically about prevention education. So moving into the resources, moving into the Generation RX resources, I just wanted to call out, again, the audiences, so to get the wheels turning in your brain about how you might be able to use these resources in your community. You hopefully engage with at least one of these audiences. Some of you focus specifically with youth, while others, have much broad focus on various audiences. For you to use the Generation RX resources. You can see them listed. Certainly coalition meetings, working with any sort of civic organization, faith-based organization. The schools are great resources and great partners. I'd be remiss to say, don't forget to work with your local pharmacist. And then I would also say that we have strong interest from elected officials, both statewide and nationally, to provide community resources to their constituents, and Generation RX is one of those resources that they utilize. So if you have a relationship with your elected official, either local, state, or federal, I highly recommend you engaging with them on Generation RX. Okay, so what are you going to find on the website? What are you going to find on generationrx.org? I wanted to highlight the 3 key areas that I recommend you take a look at. When you're first going onto the website, I think it's important before you can think about educating others that you should have a strong overview of the issue. And I think Ken's first part of the presentation was really helpful in giving you that overview. If you would like to learn more about the issue, take some online classes that are all free that are posted there on the website, and then identify some resources to help others. You can do that through the Learn section on generationrx.org. And Learn is a page link that you'll find from the home page. Once you do that and you feel like you are ready to now take action in your community and share the education with others, you would go to the Take Action tab, and that's where you'll find the extensive library of all of our Generation RX resources. They're organized for you as best we can by age and audience. So take a look at that, identify, first look at the audience that you're most interested in working with, see what kind of materials are there. We encourage you to use whatever is meaningful to you and helpful. You can use as little or as much as you'd like, and it's all there for you to download, print, share, either electronically or through paper version, whatever makes the most sense. And then the third area I would call out is the story section. We really have a lot of insightful articles from various folks, subject matter experts, from the research side, from the prevention side, from even the treatment and recovery side on the issue. And then we have stories of Generation RX champions that are sharing how they have been involved in their communities and use the Generation RX resources to the benefit of educating others. So those are the 3 areas I recommend you take a look at on generationrx.org. I did want to make sure that everyone knew when you think about what Generation RX teaches, you can summarize it in 4 key messages. And I say new look, but same key messages, because if you were familiar with Generation RX for the last several years, the look and feel of the resources might be a little different to you. Just about a year ago, we did a total refresh of the look but the messages and the content has really stayed consistent. And so what do we talk about? Regardless of the age, we really focus on four key messages. They are only use prescription medications as directed by a healthcare professional. Number 2, do not share or take someone else's medication. Number 3, keep your medication safe. And 4, model safe medication practices, particularly those adults. So we keep these messages simple on purpose because we really want Generation Rx resources to be used by everyone. You certainly do not have to be a healthcare professional. You certainly don't have to be a physician or a pharmacist or somebody that has medication safety expertise. The intent is to be able to share this education in a broad way, regardless of what your background is. So now I'm going to give you a little bit more detail on our resources that were recently updated for adults. So as I mentioned, we have multiple resources available based on age, and Molly's going to walk you through the teen and elementary resources, but first I'm going to walk you through the new adult education. And so it has an all-new content and look, so if you were familiar with the look before, you'll find that it's very different, very refreshed. And it includes multiple pieces. The first piece, and really you get this with all of the educational resources of Generation Rx, is a facilitator guide. The purpose of this guide is to set you up as the facilitator to have the conversation in your community or in a small group session, even with the staff of the organization you work with, if that makes sense. It says, this is how you facilitate a conversation. These are some of the things to look out for. Here's some ways to set you up for a successful conversation. Then we have an introductory letter. This is a new piece that we added at the request of several folks that had wanted to have an overview piece to be able to send to organizations or folks that they wanted to introduce Generation Rx to and put the ask out there to come do a Generation Rx presentation. That introductory letter is in Word, Microsoft Word, so you are welcome to customize it with the greeting and the contact information for you or your organization, and you'll find that with the rest of the resources. And then we have a Q&A session guide, again wanting to make sure that we set you up for success with common questions and answers that you might be able to tell the audience during the presentation. And then the actual presentation, which is a PowerPoint presentation with verbatim facilitator talking points. And I always want to make sure that folks know that, these resources have been many hours of expertise have been put into thoughtfully writing the content for this. And so really they're ready for you to use. I would say that you may want to make one adjustment to the content, and that might be to add in some local statistics specific to your area or to a certain audience that you're presenting to. It is PowerPoint, so you can add in a slide or two, but we really recommend keeping the content the same as is because that's really been vetted out as the expertise from a medication safety perspective. And then the final piece is the Take Action handout. This is something that you can provide as a part of a presentation, or maybe it stands alone. You can hand it out at a health fair or a brief time where you might see somebody and you want to give them some education about safe medication practices. So now I'm just going to show you a couple visuals of the pieces. You've got 3 of them in front of you. The left is the facilitator guide overview. This is definitely an eye chart, so you're not expected to read the content, but I just wanted to give you a sense of what it looks like. The middle piece is the introductory letter in Microsoft Word. And the third piece is the Take Action handout, which is double-sided. And all of these pieces are formatted for you in an 8.5 by 11 format, and they should be ready for you to print from your home printer or a local office printer. So here are examples of the PowerPoint presentation. This is the content that you would be sharing, and then of course behind each of these PowerPoint slides are the talking points to associate with each slide. So you can get a sense of what is some of the content that is discussed. For example, this is the adult, so we discuss the scope, causes, and consequences of misusing prescription drugs. We identify the 4 key messages for safe medication practices, and then we discuss how you can take action at home or in your community to educate others about safe medication practices. So that's an overview of the adult education resources. I did want to make sure that those on the phone that are part of the nonprofit community are aware of some grant opportunities that we have that are supported by the Cardinal Health Foundation. And I know some on the phone might have already been recipients or applied for Cardinal Health Foundation grants in the past. I do want to make sure you all know that we plan to have future grant opportunities. We don't have a grant opportunity open at this time. We typically have one window open per calendar year. That likely for this year will be the end of 2016, early 2017 calendar year. And you would find that information in addition to Drug Free Action Alliance sharing it and through some other communication methods. You would find all the details on our website, cardinalhealth.com/community. I would also say that we have other Cardinal Health Foundation grants that are unrelated to prescription drug misuse. So if it's meaningful for you to take a look at our other grants that are primarily related to healthcare safety and preventing errors within healthcare as well as community wellness, you might take a look at those as well. And then one of the last things I wanted to mention to you are two other partnerships that we have related to the Community Coalition folks, and that is through Youth to Youth, which is a Columbus-based organization. I imagine several of you on the phone that work with youth in your organizations are familiar with Youth to Youth International, but I just wanted to make sure that you all were familiar that they are just a fantastic resource. They've been around since the early 1980s. They have their focus on youth-led prevention, so youth teaching youth, particularly high school students. They also have trainings available for adult advisors, as well as youth leadership conferences that actually start at the end of the month here. There's a conference here at Capital University here in Columbus, and there will be several hundred high school students that attend that. We have worked with them specifically on a youth-led prescription drug misuse prevention program called the Farming Effects, and there will be an opportunity here in Central Ohio in 2016 to have a live training. We'll make sure to get those details out to you. And then if you're interested in being a part of a learning collaborative to bring the Farming Effects presentation to your community and to your organization, you can be a part of a national learning collaborative that Youth to Youth is doing. I do also want to mention a new partnership we have in the last year with CADCA, the Community Anti-Drug Coalitions of America, which is a national nonprofit organization. Many of you may be members if you are recipients of the federal grant, the Drug Free Communities federal grant, because they are the technical assistance provider for those federal grants. They have over 5,000 members really across the world who are community coalitions and community organizations that are doing prevention education and prevention work. Many of those organizations are focusing on prescription drugs as one of the substances that they prioritize as an issue in their community. And so we wanted to share Generation Rx resources with them. We've done that in a variety of different communication methods this year with CADCA, and we're finishing up a pilot right now with working with 3 coalitions in West Virginia, Rhode Island, and Wisconsin, where those coalitions have been using the Generation Rx teen resources and with the goal of creating a resource guide to give recommendations for community coalitions to use Generation Rx in a meaningful way in their community. So please look out for that coming likely in July. I do also want to mention that Dr. Nicole Quick and I, who Dr. Quick is Dr. Hale's counterpart, co-director of Generation Rx at Ohio State University College of Pharmacy. Dr. Quick and I are going to be leading a podcast with CADCA in June, kind of similar content to what we're talking about now. So it's another opportunity for you to further learn about Generation Rx. My last closing thoughts are some recommendations for how you as community members and community coalitions can get involved. And I wanted to break it down by youth education, parent education, and community. So with youth, we strongly recommend using the youth resources in the K-12 schools, really anywhere you have youth advisory board meetings, after-school programs, summer camps, wherever it makes sense. Molly's going to talk about what those resources are here in a minute. And then certainly with parents, there's always a great opportunity to share that education and the importance of modeling the safe medication practices in the home. And then finally, community education, recognizing that the voice of community coalitions is so strong. So as you continue to think through what resources make sense for you to educate your community about the substances that are of particular concern there, we recommend using Generation Rx when you're talking about prescription drug misuse. And of course, I'd be remiss to say it's always great to partner with your local pharmacist too, so don't be afraid to reach out to them. All right, so now I'm going to pass it off to our third and final presenter today. Dr. Molly Downing is a clinical instructor at the Ohio State University College of Pharmacy and has significant expertise on working particularly with youth and with teenagers. And so she's going to share some information about our resources for audiences as well as strategies for engaging youth. I'm going to pass the headset off to her, so it'll be just a minute of silence. Thank you.
Well, thank you, Betsy, for that introduction. So as Betsy mentioned, I'm going to feature our educational resources for youth and also touch on some strategies for engaging youth around this important issue. So first we're going to talk about our resources that educate teens about this issue. And these resources have a theme of My Generation RX. So we'll begin by featuring My Generation RX Teen Education. Before discussing the specific resources, let's consider just some basic strategies for talking with teens. So we know that teens have shorter attention spans and typically they are not inclined to being lectured to. And so as a result, we aim to create interactive and engaging resources to educate teens. We also recognize that teens know when they're being manipulated to think or perhaps behave in a certain way. Therefore, scare tactics may actually be ineffective with this generation of teenagers. As a result, our strategy was really to focus on teaching teens how to safely use medication in an effort to help them make informed decisions when and if they're presented with the opportunity to misuse a prescription drug. So again, I mentioned that the theme for our teen education resources is My Generation RX. And this theme really encourages teens to incorporate the Generation RX messages that Betsy mentioned into their individual everyday lives. So My Generation RX emphasizes the positive choices the majority of teens are making and really invites them to share their own story of how they safely use medication and thereby prevent misuse. So as a result, our activities and resources within My Generation RX really emphasize three principles. So they emphasize safe medication practices, they emphasize teaching teens key skills to turn down invitations to misuse, so how do we say no to these invitations, and also positive alternatives to cope with the demands of life. So instead of misusing a prescription medication to manage your life, what are some positive, healthy approaches that we can take? So what resources are included in My Generation RX? So first there is that comprehensive facilitator guide that Betsy mentioned was available with our adult resources. That same guide is available with our teen resources as well. In addition, there's 5 standalone activities with varied delivery techniques. So for example, we have an interactive PowerPoint-based presentation. There is a game. There are 2 skit-based activities, and then there is a set of short minute activities, each activity lasting maybe 5 to 10 minutes in duration. And the last resource available within My Generation RX is a tips and advice handout. So at this point, I just kind of want to overview each of these resources and talk a little bit more in detail about how you can utilize them. So we'll start with a facilitator guide. So this facilitator guide, the format is very similar to what you'll find for our adult resources. So while it's one guide, it really contains 5 resources within this kind of single PDF file. So for example, the first resource you'll find, similar to our adult facilitator guide, is a Getting Started guide. And this is really just a guide to help you plan your program. We've also included activity snapshots. So this is essentially a snapshot of the agenda and the required materials for each activity. So what do you need to do before the activity begins? What do you need to do during and after the activity? Again, similar to our adult resources, there is an introductory letter. It is a Word document, so it is customizable. So facilitators can share this with leaders of the organization that you've selected for your program. Again, it's designed to assist you in introducing the purpose of your educational program and the importance of presenting this information. A Q&A session guide is available. So again, similar to the adult resources, it's a resource that contains a list of frequently asked questions by team participants with suggested responses. And then something new is a resource called Staying Connected. So this is actually a list of pre-populated prevention messages for facilitators or other youth organization leaders that they can tweet, text, or post to teams through social media. So that was the facilitator guide, and now we can kind of feature our menu of activities. So this table is actually a part of the facilitator guide, and it kind of organizes our activities according to group size, length, and technology requirements. So you can see that the menu of activities really kind of reflects diversity in these three areas. So each activity was intentionally designed to serve as a standalone resource. So you could just do one activity by itself, or you could combine a couple of activities depending on the length of your program. So for example, if you wish to present a 1-hour program to teens, you could easily present the Medication Safety for Teens presentation, or you could present plot twists combined with a few minute activities. Alternatively, you could maybe just play the Champions of RX game or present one of the skit-based activities called Lead the Scene. So again, if you only have 5 minutes to engage a teen, or if you have 30 minutes or an hour, there's an engaging hands-on activity available to educate teens about this issue. So now let's kind of overview each of these activities in a little bit more detail and just kind of tell you a little bit about the focus and what teens will be learning by kind of being engaged in each of these activities. So first, our interactive presentation, which is titled Medication Safety for Teens. So this presentation focuses on teaching teens those safe medication practices. So really, how do we safely use medication? And opportunities exist in the presentation to reset their attention span by engaging teens to work in small groups to define misuse, to identify reasons for misuse, as well as identify positive alternatives to cope with the demands of life. And again, similar to our adult resources, specific facilitator talking points are included for each slide, and they're actually available as a separate resource on generationrx.org. So where you'll find each of our activities, you'll also find a separate link to download these facilitator talking points with the idea that you can print these off, bring them to the program with you, and it'll walk you through exactly what to say on each slide if you find that helpful. The second resource we have is a game. It's called Champions of RX, and this activity is actually an updated version of a previous game we had. It's called Generation RX Family Feud, if those of you have utilized that game in the past. So the delivery of this game is flexible. So we have included a PowerPoint presentation to aid in playing the game, but if you have technology limitations, you can still play this game without technology, and we've indicated how to do so in the PowerPoint itself. So the focus of the game, again, we're focusing on teaching teens those safe medication practices, also emphasizing positive alternatives to misuse, and identifying approaches for turning down the invitation to misuse. Again, like that interactive presentation, there are specific facilitator talking points for each slide available to download as a separate resource on generationrx.org. We have 2 skit-based activities that you could implement in your educational programming. So the first skit-based activity is called Lead the Scene, and it actually includes 2 parts. So in part 1, teens will watch 3 separate scenarios from a theatrical performance And this theatrical performance is actually posted as a video on generationrx.org. So the idea is that you would pull up the video, you would play a scenario, and then you'd engage teens in a discussion about that scene, and then you would move on and watch the remaining 2 scenes. So that's part 1. And part 2, and this is really the kind of active part of the activity, teens then participate in a skit-based activity to apply what they've learned. So each group would receive a specific scenario from the theatrical performance, so one of the scenarios that they watched. And as a group, they have to brainstorm different choices that characters could have made to ensure a more positive outcome. So essentially, they're traveling back in time and they're exchanging any negative choices made by those characters in the scenario for a more positive choice. So they have to perform their new scenario as a skit where they're essentially demonstrating how to implement that more positive choice as well as reveal possibly different, more positive outcomes that could have occurred. Again, we have a specific facilitator talking points available for you with this activity on generationrx.org. And the last skit-based activity is called Plot Twist. So in this activity, we actually provide 4 realistic scenes. Each scene is a scenario where a teen is actually invited to misuse a prescription medication. So teens are divided into their small group. They receive one of the 4 scenes where they are invited to misuse a prescription medication, and their task is to figure out for their scene, what's the best way to handle the situation? How do we turn down this invitation to misuse? So they actually perform their written scene and then perform their approach for turning down the invitation to misuse, as well as offer suggestions of positive alternatives to cope with that particular situation. So the situations range from maybe an invitation to misuse prescription medications for studying purposes, all the way to that typical kind of party scene, to misusing their own prescription medication to kind of manage pain. Okay, so there's a variety of scenes here. Again, specific facilitator talking points, including suggestions that we have for how to best handle each scenario, are available on generationrx.org. So our last activity are minute activities. Again, these are short hands-on activities, each taking 5 to 10 minutes, that exist in 2 forms. So you can present these as group activities where maybe you have a small group, you divide participants into groups of 4 to 5 people, and you use them maybe to serve as an icebreaker before a program starts. Maybe you do 2 or 3 of them to serve as a complete standalone activity. Or maybe you can just conduct one during a longer presentation to kind of reset a teen's attention span. We also have minute activities that we've labeled as individual activities. So these are designed for teens to complete as individuals. So maybe you're hosting an informational booth at a health festival, and you want to conduct 1 or more of these activities at your booth to engage teens. So that would be a great use for these activities as well. And the last resource we created, again, was our tips and advice handout. So this summarizes our key messages for teens. Again, you may wish to distribute the handout following a live program, or again, if you have an informational booth at a health festival, this would be a great place to distribute this handout as well. We have ways, as I mentioned, to stay connected with teens after completion of that live program. So teens can actually follow us directly through Twitter and Instagram. We also encourage youth leaders and program facilitators to follow us, allowing you to retweet or repost any messages that we might share. And again, we have that Staying Connected resource in our facilitator guide that allows you to post these pre-populated prevention messages with the teens in your youth organization. So this kind of wraps up the My Generation RX teen education, and now I just want to quickly overview Medication Safety Patrol, which is the theme for our resources for elementary education. So we know that prescription and over-the-counter medications are typically accessible and visible in our homes, but with age-appropriate messaging, we believe that we can actually include children in a conversation about medication safety. So what do we consider age-appropriate messaging? Well, it's really a version of those key messages we have for Generation RX. So for example, to teach children to only take medicine with permission of a parent or guardian, the importance of not sharing medication or taking somebody else's medication, the importance of keeping medicine in its original container, and also teaching children why adults should always store medication in a safe place. So we believe that by educating children about medication safety, this will really equip them with a solid foundation for how to safely use medications before they enter their teen or adult years. And again, we want to stress that this collection of resources, they do not discuss the misuse of prescription drugs. They only focus on teaching medication safety. So what are strategies for talking with children? Well, as Betsy mentioned, we want to encourage adults and youth leaders to teach and model safe medication taking behaviors. Second, children may not be able to really understand these practices if we just discuss them. So we found that by using visual aids to demonstrate these practices or giving them a situation and asking them to make a decision can be very effective. Like teens, children have a very short attention span, and so we encourage you to think of your life program as blocks of several activities. And we encourage you to actually repeat these messages through educational programs, or if you have a little one, incorporate these messages into their everyday lives when appropriate. So again, our theme for elementary education is Medication Safety Patrol. And like our other collections of resources, we do have an overview document. So these resources are appropriate for children in grades K through 5. Our overview document has a getting started section, has a letter home to parents. So you can print this and send this letter home with each child to inform parents of the topics discussed in the program. It also identifies a menu of activities, and those activities can be divided into 4 sections. So we have active stations, games, supplemental worksheets, and visual aids. And I'll just quickly overview each of these sections. So our active stations include 3 short activities, and there is an additional 4th activity you can conduct as a larger group. So again, the idea is you just divide the children up into small groups, allow them to rotate through each activity, and collectively they emphasize our key messages introducing children to medication safety. We have 3 games as part of Medication Safety Patrol. Each game is delivered through a PowerPoint presentation, but again, we've noted how you can play this game if technology is limited. So we have a game called Candy versus Medicine. This is appropriate for children of all ages, and it helps them to distinguish the differences between candy and medicine. We have a game designed specifically for younger children, maybe in grades K through 12, called Good Choice or Bad Choice. So they have to decide whether someone made a good or a bad choice regarding medication. And then lastly, we have a game called Medication Safety Trivia. And this is a spin-off of Jeopardy, and it's ideal for older children in grades 3 through 5 to play. The third category of resources are our medication safety worksheets. So these are really supplemental worksheets, and there's a variety of them. So we encourage you just to look through and see which one might be appropriate for the children that you're educating. And we encourage you to maybe allow children to work on these independently during your live program, or send them home and allow them to work on these worksheets together with their parents. And then our last category are visual aids. So there's essentially 3 posters, and you can consider printing these off and posting them in high traffic areas. So maybe your local library, maybe the schools, anywhere where children or their parents might be. And that wraps up our Medication Safety Patrol elementary education resources.
Thank you very much, Molly and Ken and Betsy, for sharing so much information with us today. As as I can say, as someone working with coalitions, it's so important that we have ready, available resources that our folks can use and understand and try, and we greatly appreciate you sharing them with us today. We do have a few questions come in throughout the course of the presentation, and we will certainly want to give an opportunity for us to check those out. If I can just direct the first question to Betsy. We had a lot of interest. Are these grants?
Thanks, Brittany. That's a great question. So, so the grants that the Cardinal Health Foundation gives are not just limited to Ohio. We have had national grant programs. Most recently, our national grant request for applications around drug disposal promotion and education was a national grant. And so our work on Generation RX is national, and so the vast majority of the work that we do in grants is a national opportunity as well. So you do have to be a 501c3 nonprofit in order to apply. If you have specific questions about that, I'm happy to talk with you, and our contact information was on that last slide that Brittany can share.
And a follow-up question from some of our attendees. What are some of the ideal venues for engaging adults and communities with these materials?
Another great question. So ideally, the Generation RX resources would be used in a small group setting or in a group of maybe 20 to 30 folks, so you can really encourage feedback, engagement, Q&A, involvement. And so what does that look like from a venue perspective? Could be civic organizations, Rotary clubs, Kiwanis, any other civic organization that is doing this work. Could be faith-based organizations, so any sort of church or synagogue or mosque or anywhere that folks are gathering and community members might be interested in this topic. Certainly PTAs or associations with coaches. Athletics is a great place for that. If you are getting a group of preventionists together, folks that are addressing substance use prevention in the community as a whole, even if folks are not focused on prescription drugs as their main substance, I think the education complements the prevention education around other substances very well as well. It also lots of folks attend health fairs, health screenings. Certainly there's a lot of community forums happening around the states right now around the topic of particularly the opiate epidemic. And so if you have an opportunity to share those resources in front of the audience, that's excellent. Or even if there's a table where you can share the resources, I would recommend that as well.
Thank you very much, Betsy. We do have a couple of more questions, but one of the ones that's been frequently asked by many participants is whether or not these resources will be available. We have been recording the webinar today, and it will be posted on the Drug-Free Action Alliance YouTube channel. When we send out our survey evaluation for the program today, we will make sure to include that link for all of you to access easily, so I hope that will help. Some of our next questions. Ken, can you address what are some of the recommendations you have for evaluating the use of these resources?
Sure. We have a ready-to-use survey tool that's on the Generation RX website. If you go to the home page of generationrx.org, there is an online survey tool that can be used by both the participants who participate in the program and the presenter who has provided the program. So we, in fact, not only encourage you, we really like you to do this because the more data we can collect, the better. The next question that we have which relates to this is that, are these strategies and activities research-based, and have they been tested for outcomes? Basically getting at the idea of are these tools evidence-based or not. So let me just share a little bit about that with you. I think we have a baseline evidence-based for these materials for sure. So if we look at attitudes, what people know about this issue, what their behavioral intentions are subsequent to programs, we've got lots of data on that. So for example, with adolescents, we have data that's actually been published in the Prevention Researcher, volume 19, number 1, February 2012, which has data from teens and adolescents who have received these programs, and high percentages, 80 to 90%, indicating more aware of the dangers, less likely to share, less likely to use prescription drugs not prescribed for them. Using someone else's prescription drugs could be harmful, understanding that. And then secondly, through the wonderful community grants that Cardinal Health provides, and this has been for a number of years now, we have data around those grantee use of these materials. So thousands of people who have used these with different age levels of folks. So for example, 92% of youth who have been exposed to these resources through those grants say they will not use prescription drugs that are not prescribed for them. 99% of adults agree that I will only use prescription drugs as directed by a health professional, and over 99% of seniors are saying I will store prescription medications in a secure location. Those are just examples. So we have good data on understanding the issue, on behavioral intention, on raising awareness. What we're needing to do in the next step is to look really at behavioral change. And so, when we find 3 months out, 6 months out, this is something that we're looking at exploring in the year or two to come. But I would say that we have what I consider a baseline evidence base now, and stay tuned because there's more to come.
Thank you so much, Ken. We are so excited to have so much participation in these questions and getting feedback from our participants. One of the questions that keeps popping up is it really free? And yes, these really are free resources. So please visit the website, take a look around. As I mentioned, we will have this webinar available online, and if you reach out to me, I can certainly provide you copies of some of this information as well as the contact information for Ken, Betsy, and Molly. We really appreciate all of you calling in today. Do not hesitate to contact us here at Drug Free Action Alliance. You will see that we will send out a survey, and we will include ways to contact me as well. If you are working in a coalition and you're looking to figure out how to use resources, how to better understand the local environment, that what's happening in your community, why is it happening, why is it happening there, what is just affecting the overall environment and culture, please know that there are resources out there. You heard some of those, some of the things that we have available to us today, but also through our Ohio Center for Coalition Excellence here at Drug Free Action Alliance. We want to make sure that we're out there to support the community prevention efforts that you're doing. So do not hesitate to reach out, to ask for information, for help, and to bring all of your great questions. And as a final note, for those of you who are involved in the community prevention work, we do have, through DFAA, a series of advocacy trainings that are available on June 14th and 15th. They are a 3-hour block. They are foundational knowledge in advocacy and how to organize your efforts and how to understand your message when we're talking about things like prescription drug abuse and misuse in our communities. They will be held in 3-hour blocks from 1 to 4 p.m. on both June 14th and 15th. You can find more information on our website at www.drugfreeactionalliance.org, located on our calendar page. Thank you all very much for attending today. Please share your thoughts and your questions, and we hope you have a wonderful week.